So I want to first introduce you to Dr. Sandra Carrillo, who's the co-founder of Medican IPS. Dr. Sandra Carrillo is a doctor of medicine, and she's a specialist in the cannabinoid-based medicine. She's a member of numerous prestigious medical societies. I mean, there are so many, and I'm sure I'm going to botch the names of some of them. But for starters, she is the president of the Colombian Medical Association of Cannabis Medicine, a non-for-profit association comprising leading doctors in Colombia. She's also professor in charge of the scientific program at the Medical Cannabis Faculty of Medicine of the University of Panama. She's created educational content. She's trained physicians and health professionals. She's developed research tools. I mean, her CV is endless. Sandra earned her medical doctor degree from the University in Medellin, Colombia, and she holds a master's degree in aesthetic medicine from Balearic Island University in Spain, and completed a master's program of anti-aging and aesthetic medicine in Argentina. She also holds a master's in health services management from the University Latina in Panama, and is certified by the Pharmacology University, a medical cannabis institute, as an expert doctor in cannabis medicine. She's completed the University of Toronto Faculty of Medicine training program for MDs, and she's a member of the International Association for Cannabinoid Medicines. And she's completed her certificate program in cannabis medicine from Amsterdam University in California. She is an advocate for the legalization of cannabinoids for medical purposes, and she is fluent in Spanish and English and conversant in French. So, Sandra, take it away.
Thank you so much, Carrie, for that wonderful presentation. And thank you to Brad for the invitation. I'm very happy to be here in this amazing conference. Usually I lecture and I teach. Usually my audience is a lot of doctors and healthcare practitioners, but it's amazing for me also to do some lecturing for the industry, because I do think that we all are an ecosystem, not just doctors, not just patients. I mean, the industry has a paramount role in this, because without of the industry, we cannot have the proper products to give the patient access to safe medication. So this is actually a very good opportunity for me to speak in front of this incredible audience. I'm going to share right now my presentation. As Carrie mentioned, I am a professor of Faculty of Medicine and University of Panama. In Panama, we still don't have medical cannabis legalized, but I've been joining efforts to give all my feedback and do a lot of advocacy with the senators and with National Assembly. We are with the government. They are creating a good legislation, and we hopefully will be soon having Panama medical cannabis legalized. In the middle of the time, with the Faculty of Medicine of Panama, we've been doing big efforts in training doctors and healthcare practitioners. So this is an initiative that I really applaud from the University of Panama, because usually in all the countries, first is coming the industry, the permits for the growing and all the chain that they need to develop these medical cannabis facilities. But in here we started educating doctors and healthcare practitioners, which I think that by the time that we have the legislation ready, we will have doctors ready to start prescribing. In Colombia, we legalized medical cannabis 4 years ago. And it's been a very interesting journey, because Colombia has a very privileged geographic position for the cultivation, and it has been attracting a lot of industries and companies. But this year, we've been having important breakthroughs in the matter that now we have finally product available for the patients. We have certain formulations that we can use, and it's actually something really good comparing with the rest of Latin America, that they're still struggling to get the proper products for the patient. So I think that's something very important. As Carrie mentioned, I am a co-founder of Medican IPS. We are cannabis clinics all over Colombia. So we have a network of different doctors from different specialties prescribing medical cannabis. So we are the first clinics dedicated exclusively to treating patients with medical cannabis. For starting my presentation, this is very fast presentation regarding to scientific evidence. Usually when I lecture for universities and for doctors, this presentation can take me 2 hours, even 3 hours, because we have a lot of scientific evidence right now, and that is really good. So I would like just to start seeing where we started with medical cannabis. We know that we are not really discovering anything. Medical cannabis is being used even a lot of years before, even 2,700 before Christ was used in Chinese medicine. Then we see also in 1000 before Christ, it was used in Hindu medicine. Then it was used in Greek medicine. We even have in the year 207 after Christ, the main surgeon in the Chinese surgery, he was using medical cannabis combined with wine to do anesthesia to the patients before surgery. And we even have a very famous doctor, his name is Avicenna, was a Persian physician. He wrote a very important book that it was called Avicenna's Canon of Medicine. And he quote in his book how cannabis has so many application. He referred that it was used for gout, edema, infection wounds, and has severe headaches. And then we have in 1839, Dr. William O'Shaughnessy. He was an English doctor who brought cannabis to the Western hemisphere, and he started using all over this hemisphere, and they were using it for many other pathologies. And we could see how in that 1839 medical cannabis was sold over the counter. So it's very sad, because then in 1937 we had Marijuana Tax Act and the prohibition came. So we are losing all the data and all the advances that all these doctors and physicians and scientists did before that because of the prohibition. And then we have Dr. Raphael Mechoulam in 1964, who discovered the molecular structure of the THC. And then we have in 1988, Alan Howlett and William Devane, that they discovered the receptors of CB1. And then we have in 2011, the Israeli government approved the use of medical cannabis for research purposes and for specific pathologies. And at the end in 2016, Canada approved the use of medical cannabis. So we see in here, I had the opportunity to share with Professor Mechoulam last year. I went to Israel, and I actually want to make a mention to him. He's turning 90 this year. It's going to be a big celebration, and very nice and humble and knowledgeable man. In here we have more of the history. We see here how in 1619 they were telling the Native Americans to start growing hemp, and then in between 1929 and 1936. Harry Ashlinger created all these story about how dangerous was cannabis, and then we had the prohibition. So it's very important to do like a very quick briefing. As I say, these conferences talking about endocannabinoid system, scientific evidence, there are conferences that can take hours and hours, but I'm going to do a very, very quick briefing. In here, we know that our body produces endocannabinoids. There are the anandamide and the 2-AG. All the mammals, we produce endocannabinoids. That's why it's so important, because we are born with that. It means our body is designed to use the cannabinoids. We have the phytocannabinoids. They are the ones derived from the plant. And we have the synthetic cannabinoids. All of them interact in different receptors in our body. We have receptors CB1, CB2, and we are discovering every day new receptors that interact with different molecules. So we see in here how complex is the molecule of cannabis, and we see in here how CBD and the different cannabinoids can interact in so many ways with the body, and in every single way interacts with enzymes, with ion channels, with receptors, produce a different situation. So we have a CBD as an anti-proliferative, antibacterial, antispasmodic. We have THCV, bone stimulant, anti-epileptic. We have all the cannabinoids. This is just a very little amount of them, and we have all the properties that they have. So we know that the plant is a complex plant. It has a lot of compounds. Right now, we know about already more than 150 cannabinoids. We have CBD, CBG, THC, and then we have the terpenes. They give the organoleptic properties to the plant. And we have all the linalool, pinene, limonene. And then we have the flavonoids and many other compounds that the plant has. And as we know, our body produces our own endocannabinoids. And we have the receptors CB1 and CB2. The receptor CB1 is concentrated mainly in the brain and central nervous system, and the CB2 are dispersed in the immune system. So in here we see how THC, CBD, and CBN interact in the different receptors. We have also seen all the properties as an antioxidant, anti-inflammatory, anti-anxiety, anti-epileptic, anti-cancer, anti-nausea, many properties that cannabis has because the receptors are spread all over the body. So we find in different parts of the body receptors that interact with these. And that is why the endocannabinoid system is in charge of control pain, appetite, sensation, inflammation, thermoregulation, mood, energy, metabolism. So all these things are very important to consider at the moment that you are prescribing the medical cannabis, and it gives you also the idea how complex it is and how important it is that when the patients are going to use medical cannabis, they consult a physician, because the patient should be followed up and monitored by a doctor. Because there is interactions. Cannabis is a very noble molecule, and as all you know, there's not until now any deaths reported by use of cannabis. So we see in here they have a role in the central nervous system, gastrointestinal system, immune system, metabolism, and we can go on and on because the endocannabinoid system is a fascinating world. And I feel bad because in faculties of medicine, they should be teaching this to students. When I studied medicine, I graduated like 25 years ago, and never anybody talked to me about this. And my dream is to change this and be able to include it in the curriculums of the universities for students of medicine. Now I'm gonna get into what is the core of the lecture that I'm giving, and it's about scientific evidence. As scientists and doctors, and when I am teaching doctors and healthcare practitioners, the skeptics ones, they said, you know something, there's not enough evidence to support the use of medical cannabis. And I love this type of debates because when you're able to prove doctors and even politicians, because remember, they are the regulators, they are the ones who are making possible that the medical cannabis come to the countries, because if we don't have a legalization of medical cannabis, the patients will never have access. So this is a very important subject that I consider everybody should know, and even the people who is in the industry. This is a very important tool to know for those that they still don't know if this is a real thing, and for those who think it works but they still don't understand very well. It's very important to know that we do have scientific evidence, but we have different levels. The highest level of evidence, we have systematic reviews, randomized controlled trials, cohort studies, and on and on. And depending on that, for a doctor, in order to be able to prescribe medical cannabis, and they taught us when we were in medical school that you prescribe medicines with scientific base. It means that you have to have enough studies to support that the treatment that you're going to do is safe for the patients, and and that it work for the patients. So in 2017, the National Academies of Science, Engineering, and Medicine did a very thoroughly review of all the studies that they were available until 2017. And they found around 20,000 articles talking about cannabis and cannabinoids. And from those 10,000 articles, 20,000, they chose the ones that they found they had strongest and better scientific evidence according to the gold standards. So talking about gold standards, we have randomized placebo control trials, and those are the ones that in the scientific community are considered good quality of studies. So in this review that they did, they found these important subjects. I put it in these four quadrants in here, because this will even make the industry and the scientists look towards where is that we need to move to get more evidence, where is that we have a lot of evidence, so for doctors they can feel more comfortable about prescribing, and where we have no evidence, but it's not because it doesn't work, it's because I think that the industry and the governments need to invest more money into research, because this is what we need to make medical cannabis to move forward. So we in here see that they found on those 20,000 articles in very reputable journals of medicine, they found conclusive of substantial evidence that the medical cannabis works in chronic pain in adults. Also as an antiemetic for the treatment of nausea and vomit in the patients that are going through chemotherapy. And also in patients they had refractory epilepsy and pediatric population. Specifically, the evidence is very strong with patients with Dravet syndrome and Lennox-Gastaut syndrome. Also, they found substantial evidence in patients with multiple sclerosis, improving the spasticity symptoms. They actually found moderate evidence in improving short-term sleep outcomes, and also in patients that have sleep disturbances with chronic pain, fibromyalgia. And they found limited evidence in patients with anxiety, weight gain, PTSD, Tourette syndrome. And they say they found no evidence in the treatment of addiction, neurodegenerative disorders, irritable bowel sound disease, and cancer treatment. So this is very important because this was in 2017. So we already have 3 years after this, and a lot of good articles with good support is being released in the last 3 years. Of course, we still need more research. I'm not going to say that this is it, that we stop in here. It's different. I mean, we need to encourage more. And all of you as industry, this is something very important, because we all need to focus in the development of novel delivery systems, of different preparations targeting different disease. So we can change the first part where it says conclusive. I do think it's gonna be double or triple in the next 10 years with all the amount of research that is being done in all over the world. What I'm going to do in here is I'm going to go through very fast a little review of the main studies that we have in the main pathologies that I already showed you. They said they have a lot of evidence. So we have this study. This was done in Ljubljana in a children's hospital. It was with 60 patients, and they proved the medical cannabis helped the patients. More than 50% of the patients who were using cannabidiol improved in the frequency of the seizures and also in the quality of life. We have this other patient that it was a study that it was done at the Sick Children's Hospital in Toronto. They were using a combination of CBD and THC, and they proved in this study that it was well tolerated and it was safe, and the side effects that the children presented were very little. So we have in here good evidence about epilepsy. This is a very famous study, New England Journal of Medicine. This is a study that they did a population of 120 patients. And in here, they were trying to prove how it works with patients with Dravet syndrome. And they found that more than 50% of the convulsive seizure frequency was improving in these patients compared with placebo. So in here, we have a study that has almost the gold standard of the research requirements. So when we talk about epilepsy, we see in here, I just showed you 3 studies, but we have already like 50 studies with different amount of patients and with different combinations, randomized, placebo control. So yes, when they ask, do we have evidence in epilepsy? We do. It doesn't mean that we need much more studies, but we do have evidence in epilepsy. Another one is multiple sclerosis. This is 5 randomized controlled trials, again, good quality of evidence, that they show in 368 patients how THC and CBD combinations improve the quality of life of the patients. They improve the spasticity, the quality of sleeping. So this is very important because most of these patients, you see a very important improvement of quality of life. Here we have another study, again, randomized control with cannabis. This was like a placebo-controlled parallel group, 66 patients with multiple sclerosis, and they show how spasticity was reduced and how just the side effect these patients presented was dizziness and nausea, but you can reduce those side effects just lowering the doses. The titration is very easy with the patients, and you start a very little doses and you start increasing until the patient finds the sweet point. That is the point where the patient feels the optimum result. So in here we have more evidence about spasticity. And then I have this other study about nausea and vomiting related with chemotherapy, another good quality study, and more studies, and cancer-related pain, another good study, multi-center, double-blind, randomized, 177 patients. They show that THC and CBD was better for the patients than placebo, and an improvement of 30% of the pain, which is a very important scale. In here we have more studies about cancer-related pain. That is something very important right now that we have. We have Canadian Pain Society guidelines. They move the cannabinoids from the 4th line to 3rd line. And we have chronic pain conditions, all these studies with Sativex, with even Nabilon. So we're seeing in here, this was the latest review. They released it last month, and they were proving how medical cannabis helped to the reduction of opioid dosage in the treatment of non-cancer chronic pain. So we have all these good studies where we see here the CDC in 2007 referred 47,000 deaths due to opioids. And the patients that have legal medical cannabis, 25% less opioid deaths. So we have a lot of studies proving how the opioid crisis can be reduced with the use of medical cannabis. So we have a lot of data in here proving that these studies showed us how medical cannabis can improve the quality of life of these patients and help to manage the symptoms. We have a lot of barriers now for finishing the presentation because we have the regulatory barriers, we have the lacking of sponsoring and support of cannabis research, and we need to improve and do more standardization in order to be able to give patients more safe access. Have an account that these populations are populations of risk. But it's very important if the doctor is seeing these patients, the doctor will know which patients are good candidates for the use of medical cannabis and which no, because there are some patients the medical cannabis is not for them and is not for treating all the pathologies. It's actually something that it has to be very well selected, and as a doctors, we have the responsibility to prescribe medical cannabis to the patients who really need it and assess all with clinical records, with lab tests, if the patient really needs it. And we will see in here how the life of a patient with chronic pain, with epilepsy can change so much. So this is a big impact. And I see the future of medical cannabis in development of new medicines, target new delivery systems. And the future, I think, ahead of us is incredible because more countries are legalizing medical cannabis. So this is like a global trend all over the world. And I encourage all doctors, healthcare practitioners to keep learning and to keep doing research. Thank you very much.